Alright, so my name's Ashley, and this is my Elisa demonstration. So the brand that we use at my hospital is the 40X Snap Plus, which it says right there. And you can see that this is the well that you'll insert the blood and conjugate into. This is your result vein, and this is the indicator that you need to snap the test. So when you start, you want to keep it this way. I just opened it, and you also want to make sure that the test itself is at room temperature, because that can sometimes affect the results, and it does explain that in the instructions. So before we start, I'll show you, because it's simply right here. So this dot at the top in the right, if that is the only dot that is presented at the end of the test, then that means that the animal has tested negative for all 4 of the diseases. And then when you go down to the next one, which is right there in the center, and be careful, I'm not touching the result, because that can also cause problems, but the one right there in the center, if that is the only one that's presented, that would be for anaplasmosis, which is another tick-borne disease. Alright, and then if you move down to this dot right here, and that one, if that one shows up at the end, that's Ehrlichia. Here to the other side is heartworm, and here down at the bottom is Lyme disease. So once again, negative, anaplasmosis, Ehrlichia, heartworm, Lyme disease. So if any of these 4 at the bottom show up, that means that they've tested positive for exposure or for active disease. And if the one at the top shows up, that means they've tested negative for all 4 diseases. So, sorry, there we go. Alright, so the first thing that you want to do is open up your kit, which includes your test and a pipette. You also want to have anticoagulated blood, and it can either be in a purple EDTA tube or a green heparinase tube. First thing you're going to do is open your mixing can. This is the conjugate, and for this test you're going to add 4 drops of conjugate into the tube. Okay. Once that's done, I always cap it so that I don't spill it. Once that's done, you're going to open your blood tube, and using your pipette, you draw up some blood and reopen the tube that has conjugate into it. Now you added 4 drops of conjugate, and you're only going to add 3 drops of whole anticoagulated blood. I'll put the excess back in my tube. Close my blood tube so that I don't lose any of that sample. I might need it later. And recap, and I like to invert 3 or 4 times to make sure that the conjugate and the blood mixes properly. Once you're finished, you're going to take your tube, and like I said earlier, this is the sample well, so you're going to make sure you hold this test completely flat and pour everything that's in here into the well. Alright, so now that I've poured the sample into the well of the Elisa Snap test, I'm going to wait and watch as it begins to go into the reservoir, which I can show you here. See, it's slowly moving up the reservoir. And then once it hits the top of that dot, that's when I'm going to hit the thumb button and snap the test. So I'm just watching because it's getting close now. So now you can see it's gone completely into the reservoir, and it's beginning to fill this dot right here. So that's when I'm going to snap. Now, that has to sit for 10 minutes, so I have my handy dandy watch here, or if you have a time clock or anything, that's when you want to set it. So I'm going to hit go, and this is now going. It's a timer for 10 minutes. And in the box that the snap test comes with, if you do not know what the positive results could be, You can find them in the instruction packet explained right there.